Let's turn attention to health matters. Nigeria's Center for Disease Control and Prevention is advising Nigerians to avoid all but essential travel to countries with confirmed cases of the Ebola virus disease. The disease agency says the National Emergency Viral Hemorrhagic Diseases Technical Working Group continues to monitor disease occurrence and has initiated measures to strengthen preparedness in the country by updating of emergency contingency plans, heightened surveillance, especially at all points of entry. And all these measures follow a report of a confirmed outbreak of the Ebola virus caused by the Sudan Switch in Wakiso, Mukono, and Mbale City in Uganda.
Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a severe, often deadly disease caused by the Ebola virus, with a fatality rate of 25 to 90%. There are 5 distinct species of the virus. The Zaire, which is the most fatal of all the 5 strains, is responsible for the most EVD outbreaks, including the 2014 to 2016 outbreak in West Africa. NCDC reveals that there are no cases of the virus in Nigeria, and it will continue to monitor the regional and global situations. It also notes that Uganda has experience in responding to EVD outbreaks as necessary action has been initiated. According to the NCDC, the risk of EVD is also classified as moderate, which indicates that EVD without mitigation is likely to occur in Nigeria. In a public health advisory, the Nigeria Center for Disease Control and Prevention advised Nigerians to avoid all but essential travel, stressing that persons already in Nigeria but with recent travel history to or transit through countries with Ebola cases in the last 21 days who experience symptoms such as fever, muscle pain, sore throat, diarrhea, weakness, vomiting, stomach pain, or unexplained bleeding or bruising should seek immediate help. Nigerians have been urged to adhere strictly to the following preventive measures. Kemi Balogun, TVC News, Abuja.
Now, a professor of virology, Oyewale Tomori, joins me on the news for more update. Good to have you join us, Prof.
Thank you, Precious. It's a pleasure to be here.
Prof, we've had cases of Ebola in the country before. We've also dealt with the COVID-19 pandemic. How well has that prepared us for disease monitoring and response?
I think if we've not forgotten what we learned, we should be prepared for this. And the way the NCDC has come out, already alerting us, I think is evidence of our preparedness.
But even at the times where we felt like we were prepared, especially for the COVID-19, people felt we still recorded cases, and Nigerians felt that enough wasn't done to sort of ensure that we do not record any case. At this moment, the good news, we do not have a case. The good news is also that at least only 1 case has been recorded in Uganda. But what sort of emergency contingency plan should we be putting in place at this moment?
First of all, let me clarify something. The fact we are prepared does not mean you are ready. When the exam comes, there is no whether you're ready. We're making the steps to prepare for it. But when the epidemic, if it does come, we will know whether we're ready or not. So I think, like I said, NCDC has taken the right step, alerting people about it. I heard what you said about the fact that travel advice to avoid the countries where those are occurring. But we should we also remember that there are certain hubs where you may not go to the country where this is occurring, but you go to a hub where people coming from those countries and mix with you. Take Addis Ababa, for example, is a hub for many people. If you go into Addis and you think you are free, people from Uganda also go to Addis. And these are some of the things. So we should spread the ball to the area where the thing is occurring, not the country. Because Uganda, East Africa is the hotspot, and anybody going in that direction should be on the alert.
And because all I hear is point of entry at the ports, right? Maybe the ports and then the airport. But what about, because I mean, we've always talked about having porous borders. What about the borders, Prof? Shouldn't that also be a sort of concern at this moment?
But when you look at the geographical situation, if this case was occurring in Togo, for example, I would look at land border. But when you look at the fact it's happening in Uganda and that fire, it's not likely you're going to find somebody who's going to come by road from that place into there. But if it is occurring among the neighboring countries, like Uganda, for example, Kenya would be worried, Rwanda would be worried, and those other neighboring countries where people can cross the border. So for us, I don't think it's that major of a problem. But at the same time, as I mentioned, the fact that I'm going to Kenya does not mean I shouldn't be worried. So I actually look at the region rather than the country itself.
And just so you know, the fact that one case has been recorded, we understand that there's a lot of contact tracing of 44 more people who have also related with other people, and so the contact tracing is on. But Prof, one of the most interesting facts here is that only one vaccine is available, and that's for one strain. Why have we not seen any efforts in terms of developing vaccines for other strains?
Yes, indeed. We have the vaccine for the Ebola Zaire, but we don't have for the Ebola Sudan. But there's a candidate vaccine which WHO has approved now to be tested at this epidemic. They call it is a kind of clinical trial. They tried it with what we had it for the first time we had Ebola in West Africa, what they call a ring vaccination. You find the case, you find their contact, and then you find the contact of those contacts. So you vaccinate around that area, kind of ring the virus around so that it doesn't escape out of your ring. So that is being practiced in Uganda right now. I think in another few days, they're going to start all that. So that candidate vaccine will be used during this epidemic. Although the epidemic is going on, the research team is also there monitoring what is happening to see how effective and efficacious this vaccine is. Like I said, there is still no vaccine, but in addition to the vaccine, there is a monoclonal antibody which can be used for treating people. And also there's an antiviral. So all the three of those will be deployed to what is happening in Uganda right now.
As this story develops, Prof, I'm very sure we'll speak to you over and over again. Thank you so much for your time, as always. I'm a professor of virology, Oyewale Tomori.
Thank you very much. It's my pleasure.